Hello and welcome. Today we're diving into a serious eye condition called infectious keratitis. This is an inflammation of the cornea, the clear front part of your eye, caused by an infection. It can range from mild discomfort to severe vision loss, so understanding it is crucial for eye health. So, what causes infectious keratitis? The culprits are often bacteria, viruses, fungi, or parasites. Bacteria are the most common cause, particularly in contact lens wearers. Viruses like herpes simplex and varicella zoster can also lead to keratitis. Fungi can cause keratitis after eye injuries involving plant matter, or in individuals with compromised immune systems. Finally, parasites like acanthamoeba are commonly associated with improper contact lens hygiene and contaminated water. Let's talk about how the infection actually damages the cornea. When these microorganisms invade the cornea, they trigger an inflammatory response. This response involves the release of inflammatory chemicals that damage the corneal tissue. The body's attempts to fight the infection can also lead to corneal scarring and ulceration. This damage disrupts the clarity of the cornea, leading to blurred vision and other symptoms. Infectious keratitis affects people worldwide, but its prevalence varies depending on geographical location and lifestyle factors. Contact lens wearers are at a significantly higher risk, especially if they don't follow proper hygiene practices. Individuals with weakened immune systems, pre-existing eye conditions, and those who have experienced eye trauma are also more susceptible. What are the telltale signs of infectious keratitis? Symptoms can vary, but common ones include eye pain, redness, excessive tearing, blurred vision, sensitivity to light, and a feeling like something is in your eye. You might also notice a white spot on your cornea. If you experience any of these symptoms, especially if you wear contact lenses, seek immediate medical attention from an eye care professional. Diagnosing infectious keratitis involves a thorough eye examination. Your doctor will examine your cornea using a slit lamp, a special microscope that allows for detailed visualization. They may also take a corneal scraping to identify the specific microorganism causing the infection. This scraping is sent to a lab for culture and analysis, which helps determine the most effective treatment. Infectious keratitis can be broadly classified based on the causative agent. We have bacterial keratitis, viral keratitis, fungal keratitis, and acanthamoeba keratitis. Each type requires a specific treatment approach. Bacterial keratitis often presents with rapid onset and a distinct ulcer. Viral keratitis, particularly herpes simplex keratitis, can present in different forms like dendritic ulcers. Fungal keratitis is often slower to develop and harder to treat. Acanthamoeba keratitis is especially painful and can be difficult to eradicate. Treatment for infectious keratitis depends entirely on the cause. Bacterial keratitis is typically treated with antibiotic eye drops. Viral keratitis may require antiviral eye drops or oral medications. Fungal keratitis can be challenging to treat and often involves antifungal eye drops or oral medications. Acanthamoeba keratitis requires a combination of anti-parasitic medications. In severe cases, a corneal transplant may be necessary to restore vision. It is important to follow your doctor's instructions carefully and complete the entire course of treatment, even if your symptoms improve. Prevention is key to avoiding infectious keratitis. If you wear contact lenses, always wash your hands thoroughly before handling them. Clean and disinfect your lenses as directed by your eye care professional. Never use tap water to rinse or store your lenses, as it can contain harmful microorganisms. Avoid wearing contact lenses overnight unless specifically prescribed to do so. If you experience any eye irritation or discomfort, remove your lenses immediately and consult with your eye doctor. Protective eyewear should be worn when exposed to environments where eye injury is likely. For individuals with compromised immune systems, proactive eye care is very important. The prognosis for infectious keratitis varies depending on the severity of the infection, the specific microorganism involved, and the timeliness of treatment. With prompt and appropriate treatment, most cases can be effectively managed. However, severe infections can lead to corneal scarring, vision loss, or even the need for a corneal transplant. Recent research is focused on developing new and more effective treatments for infectious keratitis, including novel antimicrobial agents and improved diagnostic techniques. Additionally, researchers are exploring preventative strategies, such as new contact lens materials and disinfection solutions, to reduce the risk of infection. Continued research offers hope for improved outcomes and a better quality of life for those affected by this condition.